Welcome to the Health Fix podcast, where health junkies get their weekly fix of tips, tools, and techniques to have limitless energy, sharp minds, and fit physiques for life. Hey, health junkies. On this episode of the Health Fix podcast, I'm interviewing Dr. Anne Truong. She is a board-certified physician with over 20 years of clinical experience, and she is an innovator. And in fact, she is definitely thinking outside the box when it comes to sexual health. Now, she is working with men and women of all ages to help them restore their sexual health. And in particular, today we're going to be talking about erectile dysfunction. We're going to be talking about low libido. We're going to be talking about poor circulation as it relates to low libido and sexual dysfunction. And we're really going to dive into what erectile dysfunction is really a sign of. It's a sign of something more serious going on that should be looked at and not something to be brushed aside and being like, oh, you're getting older, this is what happens. No way. This type of thing can be fixed, and it can also turn around other things that could be going on with your health. So Dr. Anne opens up lots of different doors here for folks to be thinking about their sexual health and how to improve it over 40, or really at any age, because honestly, I'm seeing folks as young as mid to late 20s having trouble with erectile dysfunction. So let's introduce you to Dr. Anne Truong and talk all about sexual health. Dr. Anne Truong, welcome to the Health Fix podcast.
Thank you for having me here. I'm looking forward to our conversation today.
Oh man, this one's been a long time coming since our first round didn't go so well and my tech issues were horrendous. So it's good to finally get you back. And the topic of circulation to our sexual organs and sexual dysfunction is such a under talked about topic in terms of my, the medical practice as is, but so many people are struggling, and man, women, men, doesn't matter. We are hurting in this department. So I can't wait to talk about your Get Hard system. But before we get there, we gotta kind of lay the foundation a little bit. So a lot of folks are seeing the commercials online for the yellow pills and the blue pills, Viagra and Cialis, and even some of the like pumping tools to kind of help men out. But women don't really have anything out there that's like a hot thing other than different creams and circulation enhancement tools. So when you came to working and specializing in this particular practice, were you seeing just that in your regular practice? How did things kind of evolve for you to be like, I need to help folks in this department?
Well, it really, for really selfish personal reasons, because as I was entering, I started doing this around 2012, and at that time, I was like in my early mid 40s, and I was starting to see some changes myself, and so was my husband. My husband had heart disease. It's familial, so it's in the genes and it's in the family. He has like high cholesterol, so he had heart disease and had to take 5 medication on top of having 2 stents in his heart, and that affected his sexual function as well. And I myself was undergoing perimenopausal symptoms as well. So we were both kind of like, all right, we're noticing a big change here compared to we were when we were in our teens, and the kids are just out of the house. They're starting to go to college. This is our second honeymoon here. Let's enjoy it. And then we're like, oh, okay, things are not working as well as they used to be. So, and that's when, and I was already doing stem cell therapy and hormone replacement therapy. So that's when I kind of dive into, okay, what's going on here with sexual health? And my husband couldn't take ED meds, and I don't want to go in that route. I've always been leaning toward more holistic, natural pathway and treating the cause of the problem rather than the symptom of the problem. And ED, or sexual dysfunction, is a symptom of some cause, and most of the time it's cardiovascular along with hormones changes. So I dive deep into sexual health and what the causes are. Took a lot of courses and collaborated with some mentors, and with the background of acupuncture, stem cell therapy, and doing prolotherapy, as well as being interventional pain management doctor. I kind of put everything that I know together along with the knowledge that I have and created a framework to look at restoring sexual function at its root cause. And the root cause is really cardiovascular system and then optimizing hormones again, decreasing stress, diet and exercise and optimizing sleep. But it really goes down to the basics of optimizing cardiovascular health, which is circulation. And that ties with everything. Almost every specialty have that common, right? Because every organ in our body and every cell in our body need to have good blood flow so it can get its oxygen and also take away the metabolite as well. Yeah, so I dive deep into it really from a personal reason, but I found that I love it because it's such makes such a impact on our patient's life. Not only is it just, it's not about sex. Trust me, it is not about sex. It's really about general health and restoring relationship again. I've been called a marriage whisperer because I've saved a lot of marriages by addressing the sexual health, but it's not about that. It's about reconnecting again. It's about getting your self confidence again and feeling like you're alive again. And unfortunately, sexual dysfunction happen when you're kind of like in a second phase of your life where the kids are out of the house, but unfortunately your hormone dip. This is around mid 40s, your hormone dips, and that's when you start having cardiovascular risk factors, which we will talk more about, that make you susceptible to having a decreased blood flow, which then affect your heart and your sexual functioning organs as well. So my point is, when you're in your 40s or so, start looking at these factors that may be contributing to your cardiovascular health, and it actually shows up as really decreased libido and sleep disturbances.
That's interesting you bring that up about the sleep disturbances because I feel like a lot of women and men too will start to notice like I can't sleep through the night or I'm having trouble, going to sleep or like I'm up at 4 a.m. and I
Mm,
can't seem to get this change going. And some people will have the sleep disturbances with sleep apnea. And so I'm guessing
yes.
you've probably seen that huge correlation there.
Yes, yes, absolutely. Well, sleep apnea decreases men and women. It decreases hormone production. And for men, it decreases testosterone production because when you have when untreated sleep apnea, this is untreated sleep apnea, you have less REM sleep or rapid eye movement. When you have less rapid eye movement, your testosterone aren't being made well, and that you tend to hang around more in the sympathetic nervous system rather than the parasympathetic nervous system, and you become a little bit more stressed. So the stress and also not able to make testosterone will then lower libido, but also affect your energy level. That's why sleep disturbances is well, we sometimes we attribute it to other causes, but when you're in your mid 40s, this shows up at wake, but your eye just open at 3:30 in the morning, like as if as if the alarm went off. Yeah. And 3:30 is the worst time to wake up because you got to get up to go back to work. There's no use going back to sleep. I've been there. Believe me, at 3:30 in the morning, my eyes will be open. And then I've also, and this is another thing, is that you just have no libido. And for women, it may be subtle, but for men, it's obvious and it shows up as like, less morning wood than normal. And it may show up that it takes a little bit longer to get there. And sometimes, he loses it. So a very subtle sign that you need to pay attention to. And because the reason why I say that is that if you start early, addressing it early, you're gonna make a whole big impact on restoration of performance.
It's huge to, I can't say enough about mentioning this to your doc because I think a lot of people are embarrassed, right? And same thing with like a libido. A lot of women will now start to tell me more that I didn't hear this 10 years ago. Not many people were talking like that was, we'd had to pull it out of them, right? But libido is such a factor. And with libido, I think a lot of people have tried different things like Damiana and, horny goatweed and even deer velvet antler and things. And they're like, I'm not getting results. What would you say to folks who have tried different things with the libido and nothing seems to be working?
Well, believe it or not, you got to get back to the basics. Sometimes we chase shiny object, right? This work, this supplement. Get back to the basics. What are the basics? Diet, exercise, sleep, and stress reduction. All of those factors actually will lower your hormone and affect your blood flow. All right. So that's what I call the basics, right? Because what you eat is what your body's gonna feed your body. Every cell in your body is gonna absorb what you eat. And it's like your car, it requires super unleaded gas, but then you're giving it regular gas. What do you think is going to happen? It's not going to function as well, right? It can still drive, but it's not going to be an optimal performance. So you got to give your body what it needs, which is really, what we call kind of the Mediterranean diet, a diet focusing on lean meats such as chicken, fish, more vegetables, fruit. And what I tell my patient is eat what the earth gives you. If the earth grow for you, and don't eat anything in a box or in a plastic bag. Simple as that. And it's true. It's always called the caveman diet because in those days, you have to eat what the earth give you. But that's what our body is made from, right? We are made from the earth. We are in one with this earth. And if we're eating something that is made in a factory, like a cracker, the earth didn't grow a cracker for you or a cookie. The earth didn't grow that for you. So that's something to consider. And then exercise, like 30 minutes every other day, simple as just walking outside, connect with nature outside, because that will also decrease your stress level as well too. And I recommend just walking outside without headphones and listen to the nature sounds, smell the smell of nature. That really does a great job in calming down your stress system, calming down the sympathetic nervous system as well. And just 30 minutes every day or every other day. And then sleep. Can't stress enough how important sleep is. There's a reason why we have to sleep. When we sleep, our body heals physically and mentally. So we have to heal up here, but we also have to heal physically as well. That's our reset period. And if you're not getting adequate sleep, then your body's not going to be able to heal. So recommendation is 7 to 8 hours of sleep a night. And then the last part is stress reduction. That's why I recommend exercising out in nature, doing meditation, and simple things with, hanging out with people that you care about and, laugh and doing things that you love. As simple as that. And you know what? It doesn't cost you anything. You pay for your food anyway, right? You can walk outside. You don't have to join a gym, sleep. Stress reduction. It doesn't cost anything versus chasing after some supplement that you think is going to solve your problem. So believe it or not, diet, exercise, stress reduction, and sleep optimization will improve testosterone, improve all hormones, really. But what it also does is also improve cardiovascular health or increase blood flow, and therefore it improves sexual function but also heart functioning, and it really functioning for the lungs, the kidney, everywhere else, and also control insulin resistance, which is a risk factor for diabetes type 2. So it really solves a lot of adult onset acquired chronic condition such as high blood pressure, diabetes, high cholesterol. Those are the triad that we acquire as we get older, which set us up for heart disease, which then lead to sexual dysfunction, and which then lead to heart attacks or even strokes later on in life.
And a lot of those things, like you mentioned, it's not uncommon for me to see the beginnings of cardiometabolic issues in folks, like you had mentioned, the blood sugar, also, cardiovascular, cholesterol kind of stuff going up, also having different types of blood pressure issues. Now, a lot of people, may be doing all the basics, right? And they're like, hey, I'm not seeing change here. What would you say to someone who's perhaps taking testosterone? They're incredibly fit. I'm going to preface, because you kind of already knew this question a little bit, because I talked about my police officers and firefighters in my practice, who a lot of them are very fit. They're taking testosterone. They are working on, their diets, and they're not seeing changes with the libido and not seeing changes with erectile, quality, let's put it that way, how long they can last, things of that nature. What would you say to someone that might be in that category where they're kind of, the basics are down, they went to try to optimize with testosterone and they're still not having issues, or still having issues, sorry.
Yeah, still having issues, and I see that more common than not. And I would tell you, sometimes I'll see a man who'll come in physically fit, muscular, had an 8 pack, not a 6 pack, but an 8 pack, and looks like a vision of health. But and he's on testosterone. But when I do his blood work, he is not a vision of health. So, if you are on testosterone, make sure that you get your blood work checked at least once a year or twice a year, because when you're on testosterone, a lot of clinic will give you a high dose of testosterone thinking that high testosterone is better. Not necessarily. Testosterone is determined genetically. What amount of testosterone that is your sweet spot is determined by your genes. So there was a study that came out 2 years ago that shows that the testosterone receptor, or this little whole keyhole that is in every cell of your body, is different in every man and woman. That is determined by genetically. So what that ultimately means is that a man, his sweet spot where he feels great could be, the range is from 300 to 900. Will feel great at 500, not necessarily 900. And another man can feel great at 900. And so there's a different sweet spot for everyone. Not necessarily high is better. That's number one. All right. And then number two is that the higher you crank up testosterone, there's a chance it will be converted to estrogen. Estrogen is the metabolite of testosterone. So your body likes to be in balance. If you give it too much of something, it's going to try to get rid of it and try to convert it to something else. Now, a caveat, testosterone in a man is actually help with his libido. So sexual drive is also for testosterone, but also estrogen. To estrogen. So some hormone clinic will automatically give you an estrogen blocker, like an estrozole, thinking, well, I'm going to crank him up high. I'm going to give him an estrogen. Not necessarily. I will let my men be an estrogen level of about 50 or 60, even though the recommend is like less than 30. But nothing that's not necessarily you need to put that on. But I see a lot of hormone clinic automatically put a guy on an estrozole, which is an estrogen blocker. So follow your blood work. And then also, testosterone also can be converted to DHT, dihydrotestosterone, and that's an inflammatory component of testosterone, which then will irritate the prostate, will make the prostate enlarge, as well as contributing to hair loss. So when you're on testosterone, you need to check the estrogen, you need to check the dihydrotestosterone, or DHT. You also need to check what is your free testosterone versus your total testosterone as well. So that's number one. So if you're on testosterone, cranking up high doesn't necessarily mean that you're better. These men maybe feel bad because maybe their estradiol, or their estrogen, is being suppressed. All right, or that they're so high, the body is converting it to other forms. All right, so doing hormone replacement therapy is a balance, and they need to know that everyone has a different sweet spot. So that's what I would recommend. And also, when I see the men that I see that come in with an 8 pack, well, I do their blood work, and they have high cholesterol. Their cholesterol is like 280. The LDL is like 200, and their blood sugar is high. So what physically shows does not necessarily mean what is on the inside. And so what is their cholesterol level? What is their blood sugar level as well? So that's why blood work is essential to that. So looking at the cholesterol level, looking at the blood sugar level as well. And then the next part is stress, because when you have high stress, that can also deplete your testosterone level as well too. And so unless you lower the stress and you keep cranking up the testosterone is not going to be utilized efficiently in your body. And we see that a lot. So oftentimes I have these men take ashwagandha, and cortisol support supplement to lower that cortisol stress. And sometimes even lowering the testosterone level will actually help with their libido, and also making sure that they have a higher estrogen level as well too. Oftentimes, less is better. I've treated over thousands of men on hormones, and I can tell you probably I have a handful of guys that need an estradiol or estrogen blocker, but 99.9% of them do not need it. Okay, if you will not need it, guys. If you're listening to this, you will, and women too. If you optimize your diet and your exercise, so if you can literally increase your testosterone level, 30% by eating the Mediterranean diet. That in itself, yeah. Yeah, well, we have seen men literally increase it within 30, it's almost 40% by just dropping bread, dropping pastries on a daily basis.
That's so incredible to hear. Because here's the thing, I think so many people are kind of in the supersized, me society where, little testosterone is good and more must be better. And I hear this from guys all the time, they're like, well, doc, I think I need more. And I'm like, no. So it's good to hear you kind of being on the same lines as me, as less is more. Less is more, and the individuality component here is so huge.
Very, very much. When you're treating symptoms, you're not treating levels. If a person feels better, and I see this from just treating over thousands of men. Some men, like my husband, he's happy on around 600 testosterone level, where the range is from 300 to 900. If I crank him up to 900, he actually feels worse. He actually feels worse. So there is a level that you just have to find that. And then believe it or not, when we get him to that level, his cholesterol is also improved as well. So do you know that testosterone can also improve cholesterol and blood sugar as well, stabilizing cholesterol and blood sugar? And that when you have low testosterone, you tend to have a little higher testosterone and blood sugar. But when you get testosterone to an optimal level, that gets controlled much, much better.
Cholesterol, hot topic, right? Do we use statins? Do we use herbs? Do we use diet, exercise? A lot of folks are starting to say diet and exercise don't work as much for the cholesterol. I would love to hear what you're doing on your end. I know you just said the basics with the Mediterranean diet. What else do you do for folks with cholesterols that are a little bit higher and they need to do something to help adjust?
Right. Well, cholesterol is it not genetic? There are some genetic conditions that predispose you to get cholesterol 500, 600 and higher. So that you definitely need medication for. But most of the time, cholesterol is acquired. It is acquired because you don't have high cholesterol when you're younger. You get high cholesterol from your diet, and it only your liver is where the cholesterol is being produced, and it takes about 3 months to have any changes in your cholesterol level in blood work. So it really reflects what you've been eating like the last three to 4 months. All right. And so that's number one. And then number two is that there's a debate, well, red meat or lean meat, right? And I think that that's really individualized. I've seen some of my patients that are on the keto diet and they eat more red meat and the cholesterol is fine. I've seen some patient that is on the keto, they eat more red meat and the cholesterol is high. And that's where I was saying that there's a genetic component. You got to treat the patient, not the numbers. And so you got to treat, okay, this if they're high and if what their diet is about, then you can kind of tweak it a little bit. So I'm not a purist and no red meat or anything. I just like let's try the Mediterranean diet and see where you're at and see what the numbers show. So it's individualized and also sleep. Also, if you don't sleep well, it will also affect your cholesterol level as well. High cortisol or high stress increase cortisol from your adrenal, and when your cortisol is high, then you will have insulin resistance. When you have insulin resistance, you'll have high blood sugar. All right. And then we also have high cholesterol. Now, why do we care about high sugar and high cholesterol? Why do we care? Why do we talk about that all the time, right? It's because when you have high cholesterol and your blood become more viscous. Your blood it has I mean, literally, we draw our blood. We can tell which somebody has high cholesterol because the blood is a little less red and it looks a little creamy. It looks a little creamy even, and it looks like it has some fatty in it. It's a different color, all right? And so it makes your blood more viscous, more thick. And so imagine your blood vessels like a pipe like this. It's like a pipe and your blood flows in the pipe, right? Well, when you have high cholesterol, those cholesterol components kind of stick together, become like a glob, and stick to the blood vessels. All right, and then it start collecting blood sugar or the sugar to it, and it create a plaque. A plaque is like a cholesterol glob and sugar glob, and what happened is that it stick to the sides of the blood vessel, and over time it will build up and build up and build up, and then so what's going to happen is it's going to get bigger and bigger. It's going to block the blood flow going through the blood vessels. That's really the etiology of a heart attack. That's really the etiology of ED. It decreased blood flow because of blockage, and the blockage is due to the cholesterol and the glob, which then collect the blood sugar to it. And blood sugar itself, high blood sugar itself, is cause damage to the blood vessel lining called the endothelium. The endothelium is this lining that protects your blood vessels from all the toxin leaking into your cells. And so high blood sugar will kind of tend to erode that endothelial lining, which then allows for more toxin to leak into your cells, which then will cause cellular dysfunction, which then will cause like mitochondria, ATP disruption, and you see it as disease, a cardiovascular disease. You can even see it as cancer because that will also affect the DNA as well too. So believe it or not, a lot of cancer is diet induced, diet related. We know that smoking, can cause lung cancer by the same mechanism as well. So that's why blood sugar and cholesterol is pivotal to blood flow, and that's I'm trying to explain that to because sometimes people are like, I don't care. What does that mean? But if they know what that means to their health. And ultimately, what is the consequence? The consequence is that you're not getting enough blood flow to the organ, and the organs can start dying. ED, erectile dysfunction. Women have erectile dysfunction also. It means that the sexual organ is not getting enough blood flow and it's slowly dying. Like a male penis is dying, so the woman organ of a penis is the clitoris, right? And so it's slowly dying. It's like having a heart attack. It's no different. A heart attack is just you're not getting enough blood for the heart to pump. That's why you get the heart attack and it start to have scar tissue. But I want to say this for your women listeners is that your clitoris is the only organ made for pleasure, has no other function other than giving you pleasure. Versus a man, its penis is for three function is for erection, but it's also a way for him to urinate, but it's also a way for him to ejaculate. So there's three mechanism function. But for women, it is your only organ that's for pure pleasure. And that's kind of like your mini penis. But believe it or not, it's just not that knob that you see. It actually goes back further. It's actually 4 inches. It's actually 4 inches that kind of goes in and kind of spread out along the labia minora as well. So most women don't realize that. It's like, oh, I have an organ just purely for pleasure. Well, there's a reason why, right? Because it's that way you can have the pleasure organ versus the man. He has to do a lot more work. There's a different physiology there as well. But women also have erectile dysfunction because as they get older and their hormone drop, their clitoris and their labia, I don't know you know this, but it atrophy. It becomes smaller, and women when they're in menopause and they don't have hormone replacement therapy, the labia will actually shrink until a point where you don't have any. It kind of revert back to pre-puberty girls. I don't know. You look at girls when they're before puberty, they do not have a labia
Yeah.
at all. Yeah. Yeah, it actually revert back to that stage. I advise women at least to look at yourself down there like once a month and see with a mirror and see what changes there are down there. Sometimes it's good to kind of know your body and be attuned to what's going on.
100%, 100%. I'm glad you bring that up because so many women unfortunately end up to me and they're talking about even the tissue sticking together. You know, it's been so atrophied, and I just had a patient the other day with clitoral adhesions. And I'm like,
Yes.
what? You know, so if those kind of things are happening, obviously it is absolutely crucial for us to keep working on circulation in that area. Now, what kind of things can someone do? Say someone's a little bit afraid still of the bioidentical hormone replacement therapy, and they're a little bit like, I don't know if I want to do that, or maybe they have cancer history and they're just freaked out. What kind of things can we do that are non-hormonal that you see to be effective? Kind of like some of the hyaluronic creams, things like what else would you think? What do
Oh
you
yeah, right. There are some products out there that, well, first of all, before I say that, is that research has shown that hormone with bioidentical hormone replacement therapy is perfectly safe for women. It does not cause breast cancer, especially topical hormone replacement therapy. Follow closely with the doctor and being managed. For women, all they need is topical estrogen and some estrogen down there, topical, and then some progesterone capsule at night, and they'll feel great. And multiple research studies have shown that it does not contribute to breast cancer. The study that was done in about 20 years ago actually was using synthetic estrogen and progesterone. So I want to kind of set that record straight, and that no, women shouldn't be concerned about a hormone replacement therapy. In fact, we treat women that are post breast cancer on hormone replacement therapy right now, and they're doing fantastic. All right. And they need it the most actually. So, but for women that may not want to do on hormones, and they shouldn't be, but I understand, is that you can use hyaluronic acid as a lubricant. You can also use coconut oil
Mm-hmm.
as well as a lubricant, which works really well. Olive oil,
Mm-hmm.
it can be a lubricant. And you mentioned one of your patients had clitoral adhesion. In fact, using DHEA, which is a natural, non-hormonal, but it's really DHEA. It's kind of like the I would call the mother of all the hormones. It's the first component of all the hormones. You can and I oftentimes prescribe just DHEA alone down in topical in the labia area for decreased lubrication or vaginal dryness down there, and it works great as well. And sometimes it will also increase a little bit testosterone because DHEA also make testosterone. So you can kind of follow with the blood work and see. So those are simple things like DHEA, hyaluronic acid, and I can't tell you how much stress will help with the lubrication as well too. Because and I just did an episode in my podcast about when is the best time to have sex. And believe it or not, the best time is usually in the morning when your hormones are high. You rested already, and it's not at night.
Yeah.
It's not so much at night because at night your hormones is at its lowest level. You're tired, you're distracted versus in the morning. So take that into account. But yeah, there for women, I'm very passionate that women, you do not have to suffer with vaginal dryness, do not have to suffer with chronic UTI when you're in menopause, do not have to suffer with pain with intercourse. It's all reversible. All right. And those are the most common things. And do not have to suffer with hair falling out or rashes or itchiness that you normally don't have that you do have. And insomnia. You cannot tolerate waking up at 3 or 4 o'clock in the morning. That's a sign that you have low progesterone. So women have three major hormones: testosterone, estrogen, and progesterone. And believe it or not, out of all those hormones, the one that is the most is actually testosterone for a woman. So you would think, oh yeah, yes, men have a lot higher testosterone level than their estrogen, but for women, testosterone level, it's about 10% of a man, but it's still higher compared to the other two. So progesterone, when it decreases, it's the first one that decreases. When it decreases, it will affect your sleep. Okay. So that's why the first signs of perimenopausal is sleep disruption. And then the next hormone that goes is testosterone, and that testosterone help with it will affect your libido, affect with the vaginal dryness as well as muscle gain.
Muscle loss.
Yeah, weight gain. I mean weight gain. So more fat acquisition, and you don't develop as much muscle mass. So you become kind of flabby. You're kind of menopausal flabbiness, and that weight gain. You start having the tires down there that you normally don't have, and you sit down, you have that tire. I have that tire, and so that's what you notice. And then the estrogen is what it's a component that causes hot flashes, night sweats, and then also you find that your foggy brain because you're not getting enough blood flow to your brain sometimes, that you tend to forget words, and I have all those symptoms when I was around maybe 51. And it all went away within a couple weeks after having been on hormone replacement therapy. So all those symptoms that I mentioned are reversible. You don't have to live with it. I can't tell you how many women in their 70s are diagnosed with dementia when it's really they need to be on a bioidentical hormone to optimize their blood flow to the brain. And how often did you hear women being, I'm on a sleeping pill, I'm on a depression pill, and then I'm on a medication to help me remember stuff, ADHD, because I have such foggy brain, right? Yeah, those are the symptoms that actually correlate with hormone replacement therapy. I can't tell you how many times I would treat a patient on hormone replacement therapy, and we get them off of their depression medicine, their anxiety medicine, their sleeping medication, and even their blood pressure medication and cholesterol medication as well.
Yeah, it's quite impressive how someone can turn around. Now, interesting you mentioned, 70-year-old women. One of the big misconceptions I think that's out there, and help me to see how you see it as well. A lot of women will be told that, say they had menopause, they went through it early. Maybe they were like 45, and now they're coming to a doc at 60. They've been told they're out of that range to be able to support their hormones. Help us with that answer that a lot of people are hearing.
Yeah, and I think that is really more of a personal preference. Yes, there were some studies that said, well, if you're over 65, might not be as beneficial. I think I don't agree with that. I tend to look at quality of life measure for a woman. That's important, and we know that hormone replacement therapy that doesn't cause all the bad all the cancers that we're all concerned about. So it's really quality of life, and starting a hormone replacement therapy, you can feel better within like 5 days. 5 days. In fact, I just started a friend of mine on hormone replacement therapy about a week ago, and she already called me up and said, I feel so much better. My hair is not falling out. I'm sleeping better. I don't have foggy brain anymore. My energy is so much better. And that was just with topical testosterone and estradiol and progesterone capsule. That was it. So I would treat any woman that has symptoms that interrupt her quality of life at this point. And of course, you have to be followed. You have to make sure you follow up with your mammogram and your pap smear. And women, if you have a hysterectomy, doesn't matter how old you are. You're going to be in your 30s, have a hysterectomy, and you can actually undergo menopause early, even though you still have your ovaries. You may still have your ovaries, but it can still, for some reason, if you don't have a uterus there, the ovaries just don't function as well in releasing hormones. Because I have seen the past week, I've seen women in their late 30s had a hysterectomy, and they're now in full-blown menopause. already.
Yeah, 100%. I see the same. I see the same. You know, all of us seeing this can't be denied. So this is just huge for folks to listen to this, you know, and really share these podcasts with their friends. Now, of course, you have your podcast. I want to talk about that in a second, but we got to get them to hear a little bit about your Get Hard system over at Truong Rehab as well, and kind of give us a good sense of like where folks can find you, what you're up to specifically. And it sounds like men and women, not just men. However, you have a specific program for the men. Tell us about that, and then tell us about your podcast.
Yeah, so our podcast is called Sexual Health for Men podcast. It's on every podcast platform, Apple, Spotify, even on Amazon as well, and on YouTube. We also have a YouTube channel called Truong Rehabilitation Center. We're big on YouTube, and we talk about sexual health. I talk about more men's sexual health because I feel that if we start with men, women will follow as well too. Because I feel that that men need to do a little bit more work than women, because treating women, it's actually easy. It's actually really easy with the topical hormone, the capsule. You're done. You're ready. But for men, they need to do a little bit more work, as in the hormones as well as the diet and the exercise. Because for men, in order for their penis to work for a fully functional erection, they have to increase their blood flow to the penis 40 times more than baseline. So that's a lot to ask for an organ to function. So they need to do a little bit more work. So sorry, men, you do have to do more work to get it functioning. Just one thing that women don't have to worry a lot about, right? So that's why I created the podcast. But also, I've lived through it, and I have a husband that's undergone it. He no longer has issues because we have treated it. So the Get Hard system is really a system that look at treating the root cause of erectile dysfunction, even sexual dysfunction. This is not just for men, it's also for women as well too. And so it starts with the brain, because the brain is your largest sexual organ. This is for men and women. Largest sexual organ. It is not the organ below the belt, because the brain is where sexual arousal happens. Right? Because that's where you have sensory input from your five senses, such as what your eyes see, what you smell, what you taste, what you hear, what you touch. And then may I even add the sixth one, which is your imagination, what you imagine as well too. So that gets processed, and it goes to the mid part of your brain, where it mixes in with your emotion, your amygdala, your emotion, what your emotional state you're in. But if you're in a distressed state, you're in a depressed state, it's going to get dampened down. That signal going to get dampened down, right? And then that will then go to the hypothalamus, where the hormones is released. The hormones get the release, and that starts the chain of nerve signals that send the nerve signal to the nerve in the back of your brain here, the parasympathetic nervous system. So it starts in the brain, and then emotion, and then hormone, then nerve, and then from there it goes to your heart. Your heart starts pumping more, and when it starts pumping faster, it brings more blood flow to the blood vessel. The blood vessel starts to expand, so you can get more blood flow. So that's the blood vessel is the fifth system. And then the fourth system is the muscle, which more blood will flow down to the sexual organ, and the sexual organ engorges. So all the six systems of the brain, the emotion, the nerve, and the blood vessels and the muscle all had to work together synchronously to create the sexual response. And we don't appreciate it because for us, when you were younger, it will take a couple minutes to get there, right? But when you get older, it takes a little bit more time, and maybe it doesn't work as well. So in our Get Hard system, we address those six systems and what is going on with a person. So we address that with diet. First, we do blood work to see what's going on. And then we look at your diet, your exercise, your sleep regimen, what's your stress level. And we not only restore sexual function with hormones and hormone replacement therapy, stem cell therapy and using technology to help with increasing blood flow. I do a Doppler ultrasound to assess for blood flow down in the penis to measure the quantity of blood that is impaired or not. And then we optimize. And once we do the treatment to kind of boost the blood flow, the man has to continue with optimizing his diet, following the Mediterranean diet, and exercise and meditation. So we address all the six systems so that way it can be restored for function again. Because something that's important as your sexual function, it requires like all those systems to coincide together. And if one system is not working well, it's not gonna have the result that you want. So that's why sexual dysfunction or ED is very common in men. Is 50% of men over 50 will have it, and 60% of men at 60 will have it, and it's 70% when you're 70. Man, if you're 50 years old, half your friends that are guy are having issues. And I assume that's even more now because that was a study that was done in 1994. 31-year-old study. And that was not accounting for COVID, not accounting for vape and porn. And that's like another discussion, right? But all of that is very common now. And we're seeing now men in their 20s are having ED. And when men in their 20s having ED, it's really more the lifestyle factors and stress and psychological factors that is creating the issue rather than a physical factor. It's really men over 45, the physical factor play a role. But men that are younger, it's really lifestyle factors and psychological stress that's affecting their function.
Makes sense. Yeah, I'm seeing younger and younger folks, especially in the fire and police services. Our emergency responders are struggling, and stress, lifestyle, like you said.
Yeah, and we talked about that, and I call that the alpha man syndrome, and that is because at most the alpha man he may look great, but he has this sense of, oh, I can do everything myself, I can fix this myself, I'll figure it out. But he's not discussing it with his doctor, he's not discussing it with his wife or his partner, and he tried to medicate himself, and oftentimes, unfortunately, he tried to sometimes cover it up and maybe in denial or maybe resort to more alcohol as well. But believe it or not, alcohol will actually affect your erection. Yeah, one drink will help you relax. More than two drinks will actually impair your erection function. So it's almost like kind of like doing things that make your condition worse, and then you try to drink more, So it's actually a worsening way to cope. The way to start with the guys, your firefighter and EMT and so forth is just, get your blood work done. Be honest with yourself. If you're starting to find out that you're not functioning as well as you used to, go get your blood work done. Your insurance covers it, Get your hormone done, get your blood sugar, get your cholesterol checked, get your kidneys checked, get your liver checked. That's all done. That can all be found out by a blood panel, and get your hormones level checked. And see a doctor about it. And there's nothing wrong with that. You are not less of a man if you have ED. In fact, we expect all men to have ED sometime in their life. It's like gray hair. You're going to get it, but you don't have to live with it. So my message is that if you have ED, guys, you don't have to live with it. There are natural alternatives by treating the root cause of the problem. I'm a big proponent of you don't know what you don't know. But when you do know, then you can prevent it. So my mission on our podcast is to educate men and women on what they can do to optimize and restore their sexual function. Because once you know what you can avoid and what you can do to optimize your condition, you will do it, right? Kind of like how we brush our teeth. We're told you brush your teeth and floss your teeth so that way you can have healthy teeth for the rest of your life and prevent cavities, but no one talk about it for sexual health, Janine, right? Now, sexual health is such a taboo topic. You can't talk about it in the internet. I mean, I'm in Facebook jail. I'm in Google jail because I talk about sexual health, to really more preventative sexual health. But it's so taboo. It's a shameful state. It's not something you're not talk about, but it's something that's pivotal for us as human beings, right? If it weren't for sexual health, we wouldn't be here, right? And it's the most primal part of our brain that drives a lot of what we do. If you think about it, a lot of what we do as human beings is driven by sexual desire, and driven by sexual behavior. So I would like for us to talk about sexual health, like how now we're now talking about mental health.
Right.
And not make it shameful, not make it taboo to talk about it, and that to say, hey, I have ED, or women, I have vaginal dryness, or I have sexual, it's called female sexual dysfunction. There's nothing wrong with that, right? It's like, I have depression, I have anxiety, nothing wrong with that. And it's just part of living. But I'm hoping that with our channel and our podcast, that we're able to spread the message of there are things that you can do now to prevent, or if you do have issues, there are things that you can do to restore again.
So important, so important. And I think, you're absolutely right on that in terms of we need to talk about the preventative, but we also, like you said, you were the recipe, that's a whole nother website I had at times. You are the relationship whisperer, marriage whisperer, whatever you want to call it, because I think a lot of people don't realize how important this connection is to each other. And in a time when I see people sitting out eating dinner and looking at their phones while sitting out together, I'm like, if we're out to dinner doing that, what is happening at home?
Yeah. So it's yeah. Well, sometimes you got to get back to basics. And I tell you, I just went on a wedding destination trip in Bermuda for 4 days. I didn't use my phone for 4 days, and it was a very, very good feeling. And I didn't need it to use my phone. I used my phone to take pictures. That was about it. But I was not on the internet. I was not on my laptop. And you know what? Nothing falls apart. Everything was fine when we came back.
It's so true. It's so true. Gosh, Dr. Ann, I'm so glad that you're helping folks to reconnect. I'm glad you're speaking out about all of these things. And I'm also glad to hear that you are, I always like to hear open-minded folks when it comes to looking at hormones and kind of thinking outside the box. It is so refreshing to hear.
Absolutely. And I think that as clinicians, we really need to spread that word, because there's so many misconception about hormone replacement therapy, and it's actually very affordable. Very affordable. It's like cost of going out to dinner once a month. People say, well, it's not covered by my insurance, I can pay for it, but it's like $30, $40 a month. And it's for your health. And, it's like you probably pay for it more than that for going out to dinner. But it's like, if you don't own your health, who would be? So I'm on hormone replacement therapy. So is my husband as well. And now, a lot of my friends. So, I hope that, your viewers will listen to this and will feel empowered that they're all alternatives and they don't have to live with those symptoms that we talked about.
Absolutely agree. So folks, head over to Truong Rehab. So this is TruongRehab.com. And then for Apple and Spotify and all of those, what is the name of your podcast? I apologize, it's not right here and I don't want to
that's okay. So the podcast is Sexual Health for Men Podcast.
Okay.
Yeah.
Okay.
Sexual Health for Men podcast. And you just type that in and it will come up. It will mean the world to me if you guys listen and give it a review. And we would love to have more reviews on our channel as well too. And like I said, our mission is to empower education and knowledge for men and women to continue to have sexual longevity.
Huge. Thank you so much, Dr. Ann, for coming on. I sincerely appreciate it.
Well, thank you so much for having me here.
Hey, fellow health junkie, thanks for listening to the Health Fix podcast. If you enjoyed tuning in, please help support me to get the word out about the podcast. Subscribe, rate, and review, and just get that word out. Thanks again for listening.